All right, welcome to week 7, module 7. This module will provide a quick synthesis of Giddens. I'm going to share my screen. Okay, so this week we're going to be talking about the concepts of self-management, glucose, and hormonal regulation. So here are the learning objectives that you should be able to accomplish by the end of this module. So the first concept is concept of self-management, and the definition is above. So each member has an essential role in the partnership. So clients and their families become the principal caregiver, responsible for day-to-day management and accurately reporting of how their health or chronic condition is progressing. So providers such as the physician or the nurse practitioner become teachers and advisors who are responsible for helping clients and their caregivers to understand health promoting behaviors. In the case of chronic disease, providers must also help clients and caregivers to understand the condition, acquire necessary management skills, and develop an effective management plan. The healthcare system becomes the care coordination that organizes and the finances and the collection services available to patients for health enhancement and chronic disease prevention and management to ensure the continuity. Self-management education can be provided one-to-one in groups or a combination of both. Information can be relayed to the client in person or using self-instruction via mailers, manuals, books, audio, videotapes, web-based applications, and mobile applications. The content of self-management education may include information on guidelines for optimal health, promoting behaviors, the causes and consequences of common chronic diseases, medication management, system management, lifestyle behaviors, um, managing psychosocial effects, social support, and communicating with providers is the role of the registered nurse. The American Heart Association, the American Diabetes Association, the Centers for Disease Control are just some of the entities that provide self-management information and education. Your week 7 Giddens discussion question will discuss these sites. You will choose one of these sites for your discussion question. Don't forget there is a question on self-management that you should document on your Word document here. Okay, so I just paused a little bit so that we can see that. All right, the concept of glucose regulation. So glycogen, remember, is the major form of stored glucose primarily in the liver and muscle cells. It is not stored in the brain. Glycogenolysis refers to the breakdown of glycogen. So that's important to know. To glucose. So the glycogen gets broken down into glucose. Then there's the gluconeogenesis, which refers to the process of producing glucose from non-carbs, so carbohydrate sources such as protein and fats. That's what the Atkins diet does. So there's more in your chapter in figure 15.1. And then euglycemia is maintained by insulin and glycogen. I'm sorry, not glycogen, glucagon. So euglycemia is maintained by insulin and glucagon. in the healthy diet and adult. So steroid medication, which results in loss of muscle mass, increases the glucose. Other regulatory hormones released include cortisol, growth hormone, norepinephrine. Counter-regulatory hormones all lead to utilization of glycogen stores. And these hormones are also increased with stress-related conditions, both physical, such as in pain, illness, and injury, and emotional, and are therefore often referred to as stress hormones. Insufficient insulin production, secretion, insulin resistance, and excessive release of cortisol or glucagon can cause diabetes. And then as the result of diabetes, it can lead to angiopathy, peripheral, and neurovascular issues as well. It can also lead to fluid and electrolyte imbalances and acid-base imbalances, which we learned about in Module 6. Hypoglycemia can end in death, especially if it is chronic, since it blocks the typical signs and symptoms. Pregnant women, infants, older adults, African Americans, Native Americans, Hispanics, and Asian Americans have the greatest percentage of getting type 2 diabetes. Genetic and lifestyle risk factors, chronic conditions, and medications can also lead to impaired glucose regulation. So a figure 15.1 in your book should have the signs and symptoms. Blood tests that we do to assess glucose regulation are the hemoglobin A1C, which is probably the best test. It's a test of how much glucose is tied to the red blood cell in over a period of 3 months. Lipid levels to make sure that they're not developing coronary artery disease might also be checked. Renal function tests such as the BUN, creatinine, GFRs, the GFR level, and then the C-reactive protein, which is a sign of inflammation and is a precursor to developing coronary artery disease. Prevention is healthy diet, exercise. So secondary screening is using the hemoglobin A1C levels and the RN responsible for self-management, education for diet, exercise, the medications, and how to use the glucometer. And nutrition is involving the dietitian also to teach them about a carb diet, controlled diet. And there is a box 15.1 that has a list of corrective methods to treat hypoglycemia. And then there's medications that we use to treat diabetes, which are hypoglycemic agents, insulin, and statins. But just remember, there's more medications as well utilized if they have other chronic conditions such as hypertension or coronary artery disease. They might be on ACE inhibitors or statins. Okay, this is question 2. I'm going to pause there for a minute. Okay, so now we're going to talk about the concept of hormonal regulation. And that concept is, I have a definition on the slide there written above. And hormonal regulation represents the hormones produced and secreted from the hypothalamus and then the anterior pituitary, posterior pituitary, and thyroid gland. The parathyroid and renal cortex, the ovary, the testes, and pancreas. So make sure you look at figure 14.2 and box 14.1. The secretion of a hormone by the gland is in response to a certain level of a substance such as sodium or glucose level, or in response to an alteration within the cellular environments. Once secreted from the gland, hormones are transported to their target tissue. Hormones have very specific cellular effects, but only on designated cells within the target tissue. Hormones depend on receptor sites to gain access and exert their specific physiological function. To gain access and exert within the cells. Target cells have unique receptor sites from the designated hormones, such as the lock and key effect of drugs in receptor sites. There is a negative feedback system whereby information regarding a hormone level or the effect of a hormone is communicating back to the gland that secretes the hormone, which directs the need for hormone secretion or suppression. One of the simplest examples is the secretion of insulin based on serum glucose levels. A classic example of positive feedback is seen when the menstrual cycle, in which the luteinizing hormone is secreted by the pituitary gland, which triggers the ovaries to secrete extra estradiol, which in turn stimulates the pituitary gland to secrete more luteinizing hormone. Biological rhythm is the circadian rhythm with cortisol levels high in the morning and low in the evening, and then can also happen with sleep disruption. The fight or flight response, which is the release of epinephrine from the adrenal gland, is also an example of hormonal release. There's puberty and menopause as well. Assessment is to assess the vital signs, assess the patient's height and weight. So these are all assessment findings. Inspection includes palpation for any abnormal lumps or bumps, changes, diagnostic tests such as hormone levels, imaging such as a CT scan or MRIs, biopsies sometimes are done for the assessment process as well. Primary prevention is diet and exercise and avoiding accidents. And then there's secondary screenings for diabetes and thyroid for all infants and older adults. Interventions usually are a combination of diet, fluid management, pharmacotherapy, surgical options, radiation, and psychosocial support. And then here's question 3. And here are the learning outcomes. All right, thank you so much.